Welcome to Medscape Morning Report. Suicide is a major public health issue worldwide, and risk rises with increasing age. Given the aging population, it stands to reason the incidence of suicide will rise with it. But what do we know about factors that increase the risk for suicide in older adults? Most previous research has examined patients presenting to emergency departments, but for this newly reported study, investigators used the UK Clinical Practice Research Datalink, an anonymous databank, to create the largest primary care data set of its kind examining self-harm in older adults. Over 4,000 people, just over half women, aged 65 years and older, with a documented episode of self-harm were identified. Almost 80% of these self-harm episodes involved drug ingestion, 5% were self-cutting, and the remainder were unspecified. The investigators scoured records to determine what happened to this group of individuals within the year following the self-harm episode. One staggering finding: the risk for death by suicide in this population was 145 times higher than for people of the same age who had not self-harmed. A minuscule 12% of adults with self-harm were referred to mental health services during this period. A similar percentage were prescribed tricyclic antidepressants, despite the known risk of toxicity and overdose. Many primary care clinicians may not be in the habit of asking our older adult patients about self-harm, but clearly this has got to change.